Hello and welcome. In today's episode of Dr. Nora, I take you through some of the techniques that we use to help to manage the appearance of a gummy smile. First up, what is a gummy smile? Well, when some of us smile, what happens is our lip elevates and we have an excess amount of gum that is seen when we smile, as you can see in this patient over here. Now, there are a number of reasons why this can happen. This can be multi-factorial. For example, it may be skeletal in nature, in which case this is something that you're born with when you're little. Secondly, it could be due to an overactivity of the muscles that help to elevate the lip. And so when you smile, those muscles become really active and they lift up the lip and hence causes a lot of gum tissue to be shown when you smile. It could also be due to your teeth looking quite small in comparison to the gum tissue. And so it creates an illusion that you have a larger area of gum showing compared to the teeth. In this video, I'll be focusing on how we can reduce the appearance of this using minimally invasive techniques. The first procedure I'm going to talk about is anti-wrinkle treatment to help to reduce the appearance of the gummy smile. As you can see on my chart next to me, there are loads of muscles on the face, and that is why it is super important for you to choose your cosmetic injector wisely, because let's face it, if they don't know where the muscles are, then they don't know where they're going to be injecting, and that can lead to complications which aren't going to be pleasant at all. So let's take a look at our smile. So this is our mouth over here. Now, there are a certain group of muscles that help to elevate the lips, and that causes us to smile. When we move our mouth, we smile. And those muscles predominantly are the zygomaticus major, the zygomaticus minor, and the levator labii superioris aliquae nasi, which is this one coming down, running beside the nose over here. Now, this one you can actually feel. If you all just take a moment to use your two fingers, and if you put them just on your nasal flares, we call them the nasal flares, just either side of your tips of your nose like this, and if you give yourself a big smile and relax, sometimes you can feel them contracting and relaxing as you do this. Now, obviously it does depend. If you've got a lot of fatty tissue in that area, it may be more difficult for you to feel, but certainly that helps to know which muscle is going where and what helps to elevate our lip muscles. So as you can see, there are a number of muscles that help to elevate the lips. And for anti-wrinkle treatment, this can be done in a number of ways, but the way that I perform it myself is I inject a small amount of anti-wrinkle treatment either side on those nasal flares into the levator labii superioris aliquae nasi. And what that does is, rather than the muscle going up, it settles it down, and that causes a net impact. When you smile, for example, the lip doesn't rise so much, and so it just relaxes down and less of the gum is seen as a result of that. Now, of course, it is super important that you do have a true gummy smile if you're about to embark on this particular treatment, because I've seen it often, well, thankfully not that often, but I've seen it a fair few times where people think that they have a gummy smile and they've gone to practitioners and perhaps they just want the monetary value and they get this gummy smile treatment done, but unfortunately they didn't have a true gummy smile, and really they didn't really have much of a gummy smile at all. But the problem with that is once they have that treatment done, their lip lowers down lower, and so often it looks like they've got dentures, and that is not a pretty look. So please make sure that if you think you've got a gummy smile, please make sure that you go to somebody who can assess you fully and can actually make sure that you do have a gummy smile, because let's face it, you don't really want to have 3 to 4 months of looking like you've got dentures because your lip is just so lowered down because you don't have the activity of those muscles going up. So that is one way that we can help to treat the gummy smile, using a small amount of anti-wrinkle treatment into each of the muscles on the either side of the nasal flares, like so. Now, this treatment is minimally invasive. It does require 2 injection points, and the way that it works, it takes about 2 weeks for it to start working, and it should last up to 3 to 5 months, depending on your individual factors. Now, this treatment can be particularly life-changing for a lot of people out there who have been having a gummy smile for a lot of time. Perhaps they've got a wedding coming up, or perhaps they've got a big major event that they'd like to help to reduce the appearance of their gummy smile. And let's take a look at one particular example of mine. So this is a lovely lady of mine who had the gummy smile, and as you can see, when we injected a little bit of anti-wrinkle on each of those nasal flares, it helped to reduce the appearance of this gummy over here. You can see over here, this gum is really quite prominent, to this side over here, making it a lot less apparent. And I've got to say, for a lot of these patients, when they come in, they have their treatment, they are so surprised about the results of it that they keep coming back for it every 3 to 4 months or 5 months, depending on how long it lasts them for, because it really changes the facial structure. Aside from anti-wrinkle treatment into this area, there are other methods as well that you can help to reduce the gummy smile. Another one is to increase the lip volume itself. So we can do this by using lip filler into the lips. And what this does is, by using non-permanent hyaluronic acid or dermal fillers into the lip, it increases the volume of the lip. And so the net impact of that is that there's the lip is not as thin as it was, and it's covering more of the gum and the teeth themselves, and hence that causes less of appearance of a gummy smile. Now let's remember that lip fillers are quite painful, and yes, they do bruise up, and yes, they can be a little bit bloody as well, but they do last a little bit longer than your anti-wrinkle treatment, usually up to 6 to 9 months in total, depending on, again, on your individual factors. But remember, they are painful and they're not for everyone. So if you just want to kind of touch the waters and see if this suits you, perhaps going for an anti-wrinkle treatment is a better option for yourself. And then if you like it, you may want to go into a more long-term treatment methods. So those are the two main ways that we help to reduce the appearance of a gummy smile. The first is through anti-wrinkle treatment into specific muscles onto the face, and the second is for lip fillers into lips to increase the volume and therefore decreasing the appearance of the gum itself. There are, however, some surgical permanent procedures that you can have. Now, these are typically done by plastic surgeons or specialist dentists who perform these procedures. Now, the first of which is you can have a procedure to permanently lower the upper lip, and that is done by plastic surgery, whereby the doctors will reduce or lower the upper lip, and hence causes a permanent fix of your gummy smile, essentially. Another way that it can be fixed is through a dentist, and they may use crowns or veneers to make the teeth look larger. Now, this is especially useful for people who have got an appearance of a small looking tooth compared to their gum, and so they make the tooth look larger through crowns or veneers, and therefore the ratio of the tooth to the gum is more acceptable. Whatever method you choose to do, please make sure that you seek the advice of an adequately qualified healthcare practitioner, because like we said over here, your face is very valuable to you, and you have got a lot of muscles and a lot of structures that go on beneath your skin. So please make sure you choose your practitioner wisely. And if you yourself have had a gummy treatment in the past before, please let me know what you've had done and whether you liked it and whether you do it again. We would love to hear your stories. As always, I hope you've all enjoyed this video, and I look forward to any questions in the comment section below. But for now, take care and stay healthy.